My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
We wanted an international airport and a Costco, and it had both of those.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
I know it's very hard to pronounce my first name and last name. That is the reason I will tell all my students, residents, and fellows to call me Dr. C. We started a fellowship 4 years ago with the 2 positions. At this point of time, our first batch students, fellows, are graduated, and we retained them as our faculty members.
What makes the Pulmonary Fellowship, Pulmonary Critical Care Fellowship in Peoria unique is that you get not only a good training in pulmonary medicine, a good training in critical care medicine, but also it feels a lot like family here. I was actually one of the first fellows that matched here for our first year of fellowship. And so I've had the opportunity to see the program evolve from the very first year that we had fellows until now, when we have 3 full years of fellows and many faculty who care very much about the training of the fellows, and also the fellows who care about each other. So I really enjoyed my time here. I'm very glad that the group wanted me to stay and become faculty and help with the fellowship, and that I could return that favor to fellows who come and train here.
Our Pulmonary Critical Care Fellowship program is becoming very competitive, and we have a very experienced faculty that provide the critical care, interventional pulmonary outpatient clinic services, and also we have a specialty clinics that is linked with cystic fibrosis, pulmonary hypertension, interstitial lung disease, lung cancer clinic, in addition to continuity pulmonary clinic.
One of the things that stands out the most to me is, 2 things probably. One thing is that we recognize that coming in the second and third class that came, that not everyone comes from the same place and not everyone has the same background. Not everyone comes in with the same skill set. And so we decided that it was really in the best interests of our newly matched incoming fellows that they have an introductory month, that throwing them onto the floor or onto the unit to kind of fend for themselves and sink or swim kind of thing, it really wasn't the best thing for them. So we developed this introductory month where they would get exposure to anesthesia, exposure to bronchoscopy, exposure to procedures, and we could really take that month and make sure that everyone got caught up to speed and everyone would start August with all the skills they need, regardless of where they came from training-wise. The other thing that we changed over the years is, as the fellowship grew, the academic needs of the program grew. And it's an ongoing process changing the academic the didactics to meet the needs of the fellows that are there. And we've done that. Initially, we had a few lectures, and as we started having fellows train study for boards, we implemented a board review session every week to gradually, over the course of the year, expose the fellows and prepare them to sit for their pulmonary boards and their critical care boards after graduation.
We kind of encourage our fellows to get board certified by the end of the second year fellowship in pulmonary diseases, so that we created the schedule for the fellows such that they will be eligible for sitting pulmonary boards. I evaluate the fellows periodically for their knowledge, skills, strengths, well-being, concerns.
University of Illinois College of Medicine at Peoria has partnered with St. Francis Hospital, and it is one of the largest teaching hospitals in the state, and it does not get much publicity because it's easily overshadowed, but from where I came from training at Loyola, it rivals in size, and certainly the training experience you'll get here is right on par with anything you would get in Chicago.
And we have a milestone building where we have like a simulation center. So we allow our fellows to attend these simulation sessions so that they can master the skills of procedures like bronchoscopies, chest tubes, intubations. So when you have to choose a pulmonary critical care medicine fellowship, you have your own reasons. But this specialty is growing faster, and so many new skills are coming up, such as interventional pulmonary. In the past, we used to do only general bronchoscopy. Now we are able to do endobronchial ultrasound-guided lymph node biopsies, and we are able to reach difficult-to-reach areas of like a lung with the navigational bronchoscopy. And we have a specialist who treat bronchial asthma with the bronchial thermoplasty. And we also have a specialist that treat the severe COPD with air trapping with endobronchial valves. These are all the new advancements.
I'm still very close with the fellows. They are very close with each other. They would do things like have outings where they would go axe throwing and have Christmas parties and Super Bowl parties. All of this, of course, before coronavirus and everyone couldn't get together anymore. But when we were able to socialize, one of the nice things about the training program is everyone gets along very well, and everyone has a very friendly attitude, a very collegial attitude, an attitude where they very much care about each other. And I think that's very important because it can be, pulmonary critical care medicine can be very taxing sometimes, and you have to have a group of people that you can lean on and rely on and call up and ask for advice and ask for sometimes even just someone to listen to you. And you'll get that here. Not only will you get a great training, but you'll get a family you didn't realize you were going to get. This program down here, this college down here, it had everything that any college in Chicago had and more. It had the family atmosphere, the safety of a smaller city, the low commute times of a smaller city, and still all the perks of a bigger metropolitan area.
When the fellows finish training, they should be ready to go to practice, either in a rural setting, community hospital, private practice, either solo or a group practice, or become an educator, clinician, research in an academic center.
Hi, my name is Julia Samanda, and I'm from Wausau, Wisconsin.
From Markham, Ontario, Canada.
From Joliet, Illinois.
From Rockland, California.
From Kansas City, Missouri.
From British Columbia, Canada.
From Rushville, Indiana.
And I'm from Chico, California.
So I knew that there was something special about this program immediately.
I loved my time in Peoria as a resident and as a medical student.
Some things I like about our department is how supportive our faculty are.
It's a really tight-knit community.
There's lots of benefits to having a 24-hour open cafeteria. It's also nice having a little group of 10 people to call your family as you progress through these 3 years. Everybody has each other's backs, and that goes a long way when things look a little bit difficult.
I can honestly say it was an incredible training experience there.
I really wanted something that was family friendly and well-rounded.
You have an incredibly supportive learning environment, and the volume of patients that you see is incredible.
Here's one of the benefits of coming to Peoria is you get to put in some work with Life Flight.
I really encourage you to look into this program because there are so many wonderful benefits and you'll have a really great experience if you train here.
Hope to see you in Peoria.